Thoracic outlet syndrome is a peripheral nervous system disorder. It's compression of nerves or blood vessels in the thoracic outlet. Now, the thoracic outlet is that narrow space between the collarbone and the first rib. There are different types of thoracic outlet syndrome. So let's take a look at them. So whenever the nerves are compressed, this is called neurogenic thoracic outlet syndrome. When the veins and arteries are compressed, it's venous and arterial thoracic outlet syndrome. Now, more than 90% of thoracic outlet syndrome cases are neurogenic, and this is what we'll focus on today. So let's take a look. So neurogenic thoracic outlet syndrome is compression of the brachial plexus. The brachial plexus is the group of nerves from the spinal cord that control muscle movement and sensation in the upper extremities. So let's take a look at these nerves. So here we have these sensory and motor nerves in the brachial plexus. The radial, the median, the ulnar nerve. They branch out of the spinal cord, go through the thoracic outlet, down the arm to the fingers. Now, whenever these nerves are compressed or compromised for whatever reason, they can create major problems for us. So let's take a look at some of the problems, the symptoms and the causes, and how we can prevent them. So here are some common causes of TOS. It could be physical trauma, like whiplash from a car accident. This can cause damage to the nerves. It can also constrict the narrow thoracic area, placing pressure on those scalene muscles in the neck. It could also be repetitive activities that we do on a daily basis, like sports, swimming, golfing, computer work, slouching over the computer, bad posture. It could be a birth defect, like an extra rib. An extra rib in the thoracic area, that narrow area, can definitely create constriction. Could be pressure on the muscles and the joints, like carrying heavy bags on the shoulder, heavy purses, heavy backpacks. It could be a tumor. There's so many things. It could be improper use of the cell phone. When our hands are occupied, we tend to use the neck muscles to support the cell phone. That's not a good idea. That can create pressure on the muscles and constrict the pathway for the nerves, compressing the nerves. So these are just some of the things. There's so much more. So let's take a look at some of the symptoms. So whenever these nerves are compromised, they cannot work at their full potential. So they will definitely create problems for us. So let's see some of the symptoms. Now, we could be getting shooting pain and weakness in the arm, numbness and tingling, that nerve sensation shooting down the arm, pins and needles sensation. Could be limited range of motion in the cervical area. So let's see how we can prevent TOS. So we can prevent TOS by avoid or reduce some of the repetitive things that we do. Unfortunately, avoiding might be a little problematic, since some of the things that we do are just our job responsibilities. But we can definitely reduce some of them. We can even do things to counteract them, like avoid carrying heavy items over the shoulder, like backpacks, purses. We can even improve our posture. Instead of slouching, we can sit straight up, open up the thoracic area. We can do regular stretching on those pectoralis major and minor muscles, stretching the scalene muscles in the neck. These are just some of the things we can do. So if you're having any of these symptoms, it's very important to have them evaluated by your healthcare professional. If TOS is left untreated for a long period of time, it can cause permanent neurological damage. So prevention is better than cure. Now, massage therapy has been proven to be a great tool to both prevent and to treat TOS if it's from a muscular origin. Now, physical therapy is also a great option. TOS is very difficult to treat. So the best thing to do is to prevent it. And there's so many options to do that. So this is all for today, folks. If you've benefited from this video, please let me know in the comments below. And if you haven't yet subscribed to my channel, please do so to get more videos like this. Thank you again. Cheers.